Hello and welcome to another edition of Fide's podcast. My name is Jerry Serino and I'm your host, and I'm here with talent on loan from Rush. So many times when we're talking about so many of these issues, certainly abortion is a big one, but a lot of other issues that we discuss on my show and in our society. So many people will say, follow the science, trust the science, right? They want to go to the source, and certainly I agree with that. We should look at science, and we should look at doctors and scientists and researchers and so on. My guest today is Dr. Christina Francis. She is the CEO of an organization called AAPLOG. They are the American Association of Pro-Life Obstetricians and Gynecologists. And she's here to talk about her great organization and answer a few other questions. So, Dr. Francis, thanks for joining me.
Thanks so much for having me on.
Yeah, my pleasure. I'm really excited to talk to you because I love to talk to people that have, the credentials behind their name. It doesn't take a doctor or a scientist to know that life is precious and that abortion is wrong, certainly. But I love getting the perspective. So I want to first start with, let's talk about APLOG. Talk about the organization, what it is, what you do, and what people can expect if they go to the website, which I'm going to scroll here at the bottom of the screen.
So APLOG is a professional medical organization that was started 50 years ago, and we're actually the largest professional medical organization representing pro-life medical professionals in the world, with just over 7,000 members now, mostly here in the US, but some international members as well. And we exist to equip and encourage our members with the evidence that they need to support their pro-life practice and to support their patients. We believe that as OBGYNs and other medical professionals who care for pregnant women, both before, during, and then also after their pregnancies, that when we care for pregnant women, we're caring for two patients at once. And actually, that's the unique challenge that drew me to this field of OBGYN. We're really the only field who focuses on taking care of two patients simultaneously. And that certainly brings its own unique challenges as we deal sometimes with difficult pregnancies or difficult circumstances in pregnancy. But it's also such a wonderful privilege to be able to care for women during that time, but also care for our fetal patients, our preborn patients during that time. And so APLOG exists, like I said, to provide and sort of coalesce all of the research that's out there that supports the pro-life position within medicine. And honestly, I think the field of OBGYN is really the concept of intentionally ending the life of one of our patients through induced abortion really is antithetical to our specialty, certainly, but also to the practice of medicine and to the oath that we took as physicians, that Hippocratic oath that says that we will promote and protect the health of all of our patients, regardless of their rank in society or regardless of their ability or disability or their age.
Yeah, it's hard for me to get my head around a physician, specifically an OBGYN, that is not pro-life. I mean, as you had mentioned in when you were just explaining about two patients, about caring for two patients, and I've been there with my wife and all of our kids, and the doctor is caring for her and he's caring for the baby. We're checking for heartbeats, we're checking for size, we're checking all sorts of things every visit. And certainly the actual birth part of it is amazing and incredible. And it's so obvious to me. So to me, any doctor I deal with, even if it's my doctor, I want a doctor who's pro-life. To me, it just makes sense because that's a doctor I feel that is going to care for me properly. So this is so if you're watching at the bottom, I'm scrolling the website for APLOG. It's AAPLOG.org. So if you want to go there and if you want to either support or help or get involved or find a physician for you, that's the place to go. And Dr. Francis is the CEO. But the site is going to get you all sorts of really great resources. I'm looking over at the site. That's why I'm looking to my right here. It's really great. Fantastic. So I want to ask, as a medical professional, one of the things that we get lots and lots of lies about abortion. That's kind of my big thing. When I go to college campuses, I talk about here are the things that you've been lied to. So one of the first lies is it's a clump of cells. It's just a clump of cells that's just nothing. Give us your medical, even though it doesn't take medical, but it helps, right?
Yeah.
Medical opinion on the clump of cells argument.
Well, first of all, I mean, I think my flippant reply to that statement is that all of us are clumps of cells. I mean, we're still all made up of cells. That's not what's important. What's important is actually, what those cells constitute, and when you look at the DNA in those cells, what are those cells? I mean, cats, dogs, any living being is a clump of cells, but obviously that's not what's important. And when we look at human embryology, if we look at my embryology textbook that I used in medical school, the author of that textbook said very clearly that there is no scientific debate that we know, based on the science that we have now, based on the science that we've known for a long time, that a new human life comes into existence at the moment of fertilization. The moment of sperm egg fusion, you have a distinct living and whole human being that has never existed before and will never exist again. One of my big pet peeves is when people call it a fertilized egg, because at that moment of fertilization, the sperm and the egg cease to exist. You suddenly have a new distinct organism. And, even at the very beginning, yes, it's just a single-celled zygote, but it's a human zygote. And we know that even in just that one cell, that zygote has everything that he or she needs to become the full-fledged adult they're one day going to become. Nothing is added into that single cell from that moment for the rest of his or her life. All that happens then is just development, and what's required for that is protection and time and nourishment, things like that. So, I think the claim that it's just a clump of cells obviously has no basis in science. But it's also just a way of dehumanizing our really early human beings, and certainly we've seen examples of that throughout history when descriptors are used to dehumanize classes of human beings, and that's not appropriate. And so, I think for people to understand too, the other thing I like to talk about is that it's okay for those of us who are pro-life to use terms like embryo and fetus. Those are not dehumanizing terms. Those are simply stages of development. And that development doesn't end when we're born. We're newborns when we're born, then we become infants, and then toddlers, and then children, adolescents, and it goes on. So I think helping people to understand that as well. That saying the word fetus doesn't mean that it's not a human being. It just means it's a fetal human being at that stage in his or her development.
Yep, absolutely. So the one of the other areas that we the left or the pro-choicers or pro-abortionists like to say is, or they have said, and I think, I don't know if they go back to these arguments, I think they're running out of arguments, and I think the left is now just basically saying, hey, I don't care. I'm pro-abortion, right? I don't care if it's not a clump of cells. I don't care if it feels pain. I don't care if it's has a heartbeat, right? All the lies, every time the lies are proven wrong, they just continue to go. But one of them is that the baby doesn't feel pain, no pain at all. So dispel that rumor.
Yeah, absolutely. And of course, and I know that probably with the people listening to your podcast, they realize that abortion isn't wrong because a baby can feel pain. It would be wrong even if the baby couldn't. But I think for people to understand what abortion is actually doing, and that it's dismembering a living human being who oftentimes is actually pain capable. And when you let that really sink in, the horror of that, then I think for a lot of people that moves them to understand the reality of what abortion is. And, we know the evidence is very clear that as early as 12 weeks gestation, so that's about 3 months of pregnancy, that fetal human beings can feel pain. There's evidence to show that very likely earlier than that, they can feel pain. We just don't have the amount of evidence that we do for, showing that at least at 12 weeks, they can feel pain. But it's interesting to note. So there will be groups that will be quoted saying that fetuses don't feel pain until the third trimester, which is ridiculous. My response to that is, Okay, well, then if you have a baby at 24 weeks who's in the NICU who's having painful procedures, technically that's the second trimester. I assume you'd be fine with your baby not receiving any kind of pain management. Of course, they would say no. I mean, that's ridiculous. We all know that babies can feel pain far before the third trimester. But also the one of the lead researchers that they quote to say that babies don't feel pain into the third trimester is a Dr. Derbyshire from the UK, who actually recently in 2020 recanted his previous study, his previous paper that said that fetuses don't feel pain until the third trimester. He's pro-choice. He's not even pro-life, and he openly admits that. But he also says that we should be honest about what the science shows, and that he has seen now through ongoing research that it is very evident, again, that fetuses feel pain as early as 12 weeks, but likely sooner than that.
Yeah. Yeah, that was an interesting, but I never really thought about that, anesthesia, if you were doing surgery on a preborn or a premature baby. That's
Yeah,
exactly right. If they didn't feel pain, but again, it doesn't matter to your point. Even if they didn't feel pain, it doesn't really matter. I mean, ending someone's life who doesn't feel pain doesn't mean that their life is not still ended.
exactly.
But that's certainly what the left gives us. So one of the questions that I had posed to you ahead of time is like, hey, these are generally what I want to talk about is, and I don't know how comfortable you are talking about it is, or if it's just speculation or your belief, and certainly that may be the case. Is it how is it that specifically OBGYNs can be pro-abortion? I don't. I guess it's hard for me to understand, especially. I mean, it's hard as a father. I don't know how a father. I don't
Sure.
know how a mother could be, but obviously they are. Do OBGYNs that are pro-abortion, especially those that are on the board of Planned Parenthood and stuff like that,
Mhm.
did they know that they're killing a baby, or are they trying to justify it on other arguments?
Sure. Yeah, I think it is a really good question because it's hard for me to understand. From the very first time I saw a first trimester ultrasound, very early in pregnancy, you can see that baby moving around and jumping, and you get a little bit farther along and you can already start to see elements of that baby's personality even in the early second trimester. And so it is really hard, I think, to think about how can someone just to give an example, one thing I've always wondered is how can somebody who is going from one exam room where they're rejoicing with somebody, because their pregnancy is going well, and maybe they've been trying so long to get pregnant and they finally got pregnant, and they're doing everything they can to ensure that that's a healthy pregnancy and they deliver a healthy baby. And then how can you go directly into the next room and just because that child isn't wanted, be fine destroying that child's life? I mean, there definitely is a mental disconnect that has to happen for
Mhm.
that. Um, the studies show, actually, the surveys that have been done of OBGYNs show that anywhere between 76 and 93% of OBGYNs don't do abortions.
Mhm.
So most OBs actually don't do them, even though we could do them. I've often told people when I graduated my residency, I had all the technical training that I needed to go out and go get a job at Planned Parenthood doing abortions the next day, even though I've never performed an induced abortion. But that's because we learn how to empty a woman's uterus. It's just that I only empty her uterus either of an intact baby when I need to deliver her, or of a baby who's already passed away in the case of a
Mhm.
woman who's had a miscarriage. So it's not that we couldn't do them. All of us are trained in how to do them, but we choose not to do them. Most of us choose not to do them. So I think there's certainly a small percentage of OBGYNs who are what I would consider abortion activists. They are all on board 100% pushing abortion. That's a minority of OBGYNs. Even those OBGYNs, though, they fully understand that that is a human being whose life they are ending. There's no way, if they don't, honestly, they shouldn't be a doctor, because you
Right.
need to learn that, in medical school. So they know that. I think for most people who are doing them, and even for most OBs who would consider themselves pro-choice, but maybe they're not doing abortions, I think for most of them, they do actually truly think that they're helping women, which is actually more sad to me, I think, than if they didn't think that and they were just, doing it because they just liked abortion or something like that. So
Mhm.
I think that there are a lot of things in medicine. I'm not making excuses because there really is not an excuse for someone to do an induced abortion when you know what we know about the humanity of that child. And when you know what we know about what induced abortion does to women as well. I mean, it's really bad for women. It causes a lot of damage. But, I do think that there is this sense that, okay, there's a lot of things we do in medicine that are kind of distasteful that maybe we wouldn't like to do, but we're doing them because they help our patients. This abortion is not just distasteful, it's the intentional destruction of a human life. But I think maybe that's the thought process that they go through in their head of, I'm going to do something that I don't like doing, but because I think that it's really helping my patient. And I listened to, there was an undercover, I can't remember what organization it was, but went into an abortion meeting of physicians undercover, and there were actually abortionists sharing their stories of how hard it was for them to do it actually. And what they were talking about was when things happened during the course of the abortion that really made them see the humanity of that preborn child. There was sort of a variety of scenarios that they shared. But it was a struggle for most of them, and as it should be, right? I mean, this
Mhm.
is a really awful thing. And so again, I'm not making excuses for the doctors who do them because they should know better. They really should. But I do think that as a result of our training, as a result of research that shows the truth of what abortion does to women, that research is actively excluded from a lot of major medical journals. And so, going through my residency, I didn't learn about a lot of the evidence that APLOG presents to our members. And so a lot of a lot of OBGYNs really don't understand the depth of damage that's caused by induced abortion. And so I think that allows them to continue to think that even though I wouldn't want to do this or I don't do them, it's helping my patient somehow. And
Mhm.
so, I think that is where a lot of it comes from. Again, there are those on the fringe. If you go to the Physicians for Reproductive Health website, those are all out abortion activist physicians. There are those on the fringe who are definitely all about promoting abortion. But I think a lot of it is, and this is one of the things that APLOG really strives for, is we believe that our patients deserve excellent health care, and induced abortion is not that. It damages our patients, but a lot of physicians aren't aware of that, and need to be.
So really great segue, because as you're talking, I'm thinking of a number of questions, and you really kind of led right into them. So the first question is, what are, just briefly, because
Yeah.
obviously, you may not have go into detail, and everyone can find out this information on aplog.org. But what are the damages? Because that was one of my questions. Is I had someone ask me, they said, an abortion is safer than giving birth, right? So what are some of the medical damages from an abortion?
Yeah. Well, so besides the immediate complications that we see with abortions, while the abortion's being performed, like really heavy bleeding or damage to other organs, damage to her uterus, infection, things like that, there are also significant long-term effects of abortion for women. One of the most well-proven is an increased risk of preterm birth in future pregnancies. And a lot of people don't know about this. But the more abortions a woman has, surgical abortions specifically, but also if she starts her abortion with a chemical abortion process or the abortion pills, and then has to have that abortion completed surgically, which about
Mhm.
8% of women in the first trimester will, then she also has an increased risk of preterm birth and future pregnancies. And the more abortions she has, the higher her risk. And this is still a huge problem in our country. We have a really horrendous preterm birth rate in this country that we haven't been able to touch. Despite a number of interventions. And I think one of the reasons why we haven't altered it is because of the number of abortions that we have occurring in this country. And, for anyone who's delivered a baby preterm, they'll understand that that causes significant risk for that baby, especially very preterm births, which are the ones that we see an increased risk of after abortion. So before 32 weeks gestation or about 8 months of pregnancy. And so, for me with that one of the things that's the most heartbreaking for me is many women who choose to have an abortion do so because they feel like they're not yet ready to be a mom, right? So they
Mhm.
think later in life I'll be a mom and I'll have kids, but I'm not ready right now. And what they're not being told is that in ending the life of this child right now through abortion, they are also putting at risk the lives of any future children, potentially, if they deliver them preterm. And I've sat with patients who are in that very situation, losing wanted child after wanted child, due to this preterm birth issue after having had abortions. And so that's a huge one. Another one is an increased risk of adverse mental health outcomes. So we know that about 81% or I'm sorry, abortion causes an 81% increased risk of adverse mental health outcomes later in life, whether that be depression, anxiety, substance abuse. They have a 6 to 7 times higher risk of suicide, even when you compare them to women with unintended pregnancies who decide to carry to term. If they choose abortion, they have an increased risk of suicide. And of course, we have a mental health epidemic right now in this
Mhm.
country, and this is just making that worse. And then the final long-term risk that we talk about is an increased risk of breast cancer. It's not all abortions, but for women who have abortions prior to having a full term pregnancy, especially if they're very young when they have that first abortion, they have an increased risk of breast cancer. And again, the more abortions they have before a full term pregnancy, the higher their risk of breast cancer. So those are the sort of the three big long term complications, that patients experience, and we're certainly seeing, especially the mental health one, with chemical abortions, with what happens during that process, with women seeing their babies when they go through the abortion process. We're seeing that mental health toll be even worse, I think, with chemical abortions.
Yeah, no kidding. Well, when I started the show talking about, follow the science and the like, and it seems as though, all this information you stated about increased risk after an abortion, increased risk in this, increased risk in, challenges in future pregnancies, increased risk in breast cancer and the like. In a normal world and in normal areas of medicine, all of that information is really, really, really important.
Right.
Whereas it seems as though when it comes to something like abortion, or we're seeing that I think a lot with the whole transgender thing, is they
Mhm.
want to push that information aside
Right.
and ignore it, or pretend it doesn't exist or whatever. But yet it's important for a woman to know
Mhm.
in regards to her health care. And that goes for, any other health issue you might have. You need to have all the information
Yep.
so you can give your make the best decision for yourself, and so on. So a final question, and
Yeah.
this is perfectly leads into it, is, you have the various medical organizations that are out there, some general, some that are specific to your field and the
Mhm.
like. And all too often, a lot of these medical organizations that are, considered prestigious, whatever, the pediatric ones or the
Mhm.
OBGYNs, if you could name kind of what the main ones are in your
Yeah.
field, and what do they say about this topic in general?
Yeah, absolutely. So for us, it's the American College of OBGYNs, or ACOG. And they claim to represent all OBGYNs in the country, but they certainly don't, especially when it comes to the issue of induced abortion. So APLOG actually started as a special interest group within ACOG in 1973, the year of the Roe decision, because ACOG leadership wrote pro-abortion briefs for the Roe and Doe cases, the Doe v. Bolton case as well.
Mhm.
And so many of their members sort of cried foul and said, this doesn't represent us and how we desire to practice. And so they formed a pro-life special interest group within ACOG. That was the birth of APLOG. And we quickly became their largest special interest group until they dissolved that title in 2013. And then we became a separate organization. So, and more than tripled our membership since then. And what we see, especially in the last 10 to 15 years, is that ACOG now has gone so radically pro-abortion. In fact, just recently, Certainly after the Dobbs decision, they came out with a really strong statement decrying the decision, saying that abortion is essential health care. They have threatened the board certification of those of us who speak out against abortion. So they're threatening physicians who dare to speak against their radical agenda. And then just recently in the Washington Post, in a letter to the editor, their CEO said that abortion should be available throughout pregnancy without barriers or limitations. And this was the first time really on the record that they've said their radical position, and they have opposed all common sense regulations and restrictions on abortion. They have never supported a single, even safety regulation that was geared towards ensuring women still had abortions, but made sure that there were safety regulations in place for them. And they've always opposed that.
Mhm.
And so they really are just very radical on this position and ignore the evidence that's out there. And not only is that damaging to our profession, not only is it damaging to, physicians having the right information because they think what ACOG is saying is evidence-based, but it's not at all. They were the ones who sued the FDA to get the in-person dispensing requirement lifted over chemical abortion drugs so that women could order them online. None of this is consistent with good medical practice. And as you said, at the very still going to be able to access abortion. At the very least, women deserve fully informed consent. That is a basic tenet of medical ethics. It's exactly what you were saying. They deserve to know the risks that are involved with induced abortion. I think it's really paternalistic to think that the doctor can just tell the patient, this is what's good for you, and I'm not going to tell you about any risks associated with that. So, that's part of what we are trying to do in holding some of these organizations accountable. Even if they don't become pro-life like we are, we certainly would love that if they would recognize the value of all of our patients' lives. But at the very least, we think that our patients deserve fully informed consent and deserve accurate information about their health care.
Yeah. So who do you want caring for you, your baby, caring for your pregnant daughter or niece or granddaughter? Do you want a pro-life a doctor, or do you want a doctor who subscribes to the radical ACOG ideology? Which to me, just ACOG then loses their credibility,
Mhm.
because if they cannot see something so obvious and they take such a radical position, what else are they radical about, right?
Right.
What else are their members radical about? That's why I say, regardless of who your doctor is or what area of medicine, I want a pro-life doctor. And
Mhm.
that's my opinion, and it simply makes sense. Well, this was really, really fantastic. Dr. Christina Francis, CEO of AAPLOG. Please go to aplog.org, AAPLOG.org. You could see it scrolling at the bottom of the screen if you're watching. Um, Please go support, get information, support them in any way that you can. That is certainly helpful. And Dr. Francis, thank you so much for all that you do and taking time out of your day to talk to me here.
Absolutely. Thanks so much for having me on, Jerry.
Yes, my pleasure. And thank all of you for listening to this episode of Fide's podcast. Please check out all my podcasts and all the different podcast apps on YouTube, on Rumble, on Wednesdays at 7 p.m. Eastern, on rightamericamedia.com, and on WHKradio/podcast.com as well. So thank you again for listening, and we'll see you next time.